this is Dr. Abhishek Bali, consulting pulmonologist. On the occasion of World Pulmonary Artery Hypertension Day, I would like to share some aspects of the disease about which you may not know much about. So let's start with some frequently asked questions about what exactly is pulmonary artery hypertension, what do we understand about the disease, and how we can overcome the disease through medications. So the first question we would like to ask is, what are we celebrating today? Why are we celebrating World PAH Day? We are not celebrating it as such, we are raising awareness regarding pulmonary artery hypertension. So pulmonary artery hypertension, in my practice, I usually come across patients with PAH who have a long-term history of chronic lung disease. This would include either COPD, interstitial lung disease, or any other chronic ailment of the lung. In such a case, it would be a type 3 pulmonary artery hypertension, which means that due to chronic illness of the lung, the right side of the heart has gotten affected, and this causes certain symptoms in individuals such as breathlessness, which is progressive. It starts on as with a gradual breathlessness, which is progressive. Initially it was normal, but over a period of time the breathlessness comes to such an extent that the person has a hard time getting up from bed, walking short distances, or even is not able to carry out his or her day-to-day physical activities. How do we diagnose pulmonary artery hypertension? We diagnose pulmonary artery hypertension based on the following two diagnostic tests. The most commonly used one would be right heart catheterization, and which is the gold standard of diagnosis of pulmonary artery hypertension. And the second one that is used most commonly would be using a simple non-invasive test, that is echocardiography. Now, there is no known cure for pulmonary artery hypertension. What we plan to achieve with medications that are used for pulmonary artery hypertension would be to basically reduce the patient's breathlessness and improve the patient's exercise tolerance or the capability to perform his or her day-to-day physical exercises or activities. Some of the drugs that are used for pulmonary artery hypertension are very simple and can be consumed at home without any serious adverse effects or without any medical supervision. However, you need to keep in touch with your pulmonologist and your cardiologist for the maintenance of the therapy. I would like to also talk about type 3 pulmonary artery hypertension, which is due to any chronic lung parenchymal disease or chronic lung airway disease. Over a period of time, when the lung is diseased, it exerts a negative effect on the right side of the heart, causing the pressures within the right side of the heart to increase. And this is what leads to the patient's feeling breathless, the patient's ability to carry out his or her day-to-day physical activities comes down. The patient has a chronic sense of fatigue and loss of well-being. If you experience any kind of symptoms such as the ones that I talked about, and if you suffer from progressive breathlessness, please visit your pulmonologist as soon as possible for a complete workup about your condition.